Here we are on the couch with Marnie Prickett from Choose Clean Water New Zealand. Good afternoon, Marnie.
Good afternoon.
Marnie, an unusual topic perhaps to be at a rural health conference. Tell me about Choose Clean Water New Zealand and why you're here.
So Choose Clean Water New Zealand is a small group, it's a student-led campaign group on freshwater, and we've been really focused on the freshwater policy, so that's the National Policy Statement for Freshwater Management. And I'd say it makes so much sense that I'm here to talk to rural health professionals, because obviously water quality is a health issue. If we have polluted water, we potentially have sick people, and we've seen that happen in Havelock North recently. So I think there's a really strong link between water quality and rural communities' health.
But recently in the country there's been some fantastic announcements from the government supposedly.
Yeah, so we have heard some supposedly ambitious plans the government has told us on water quality, but as I said in my talk this afternoon, I broke that down, and what we're looking at is actually that they're really only focusing on 1.8% of the entire country's waterways. That strikes me, and I'm sure others, as not very ambitious, and I think we probably all agree by now that we have a major water quality problem. We've got polluted rivers, we've got polluted lakes and polluted aquifers, and that 1.8% is not going to cut it. 1.8% over 23 years even. So.
But we only use 2% of the water that falls in the country, don't we? Isn't that one of the statistics that's been...
So that's a statistic that quite often gets rolled out by the government, that apparently we only capture and use 2% of the water. But I would argue that we're using 100% of the water all the time. I mean, if we were to use all of our water, this beautiful landscape that is behind us wouldn't look like that. We would be taking out that water from those rivers. And there's the concept of, first of all, of ecosystem services, so that when you have a functioning ecosystem, it's a health benefit to humans. But also I'd say there are other ways that we're actively using it. We're using it for drinking water, we're using it for swimming, we're using it for kayaking. It's to do with our mental health. We quite often go to these beautiful places when we need a little break and some downtime. And so I'm saying that if we may not be directly capturing and pouring that water onto our agricultural land, but we're using all that water. It's important where it is.
So what can health professionals do? I mean, what's the call to action for the health professionals?
So I gave them a 3-point call to action. One was to engage in central government processes, and the first and easiest thing that they can do is make a submission to the Ministry for the Environment's consultation on this policy, on this freshwater policy. That's closing on April 28th. So if you go to the Ministry of Health's website, I keep saying Ministry of Health, but Ministry for the Environment's website, you'll find that. So that's number one. That's an easy thing to do, and I think that it would be really valuable to hear health professionals' ideas into that submission process. Second thing is get involved in the regional councils' processes around water. They are collaborative decision-making groups often, and at the moment they're largely dominated by paid industry representatives, and then usually like a volunteer or so from a environmental group. It's hugely unbalanced conversation around water, and I think bringing in health professionals to that conversation would be really beneficial for New Zealand's for the public. So that's number two, and number three is speak openly and in public, and particularly in the media. We need to hear from our rural health professionals that they are concerned about water quality. That was something that came up apparently at the last conference, that water quality was a key concern for rural health professionals, and I think that's something that the wider community need to hear, not just those in rural communities, but the whole of New Zealand needs to hear we are concerned about this. So three things.
Okay. Marnie, thank you very much for your time.
Thanks.